Hi, Dr. Sullivan of Sullivan Dermatology. I'm going to show you my favorite patient. So this is my favorite patient. If you look here, you can see he has very extensive involvement of his skin with these pink plaques with silver scale. This is classic psoriasis. Why is he my favorite patient? The reason he's my favorite patient is I am going to give him a medicine, and in a few short months, he's going to be 100% clear. And that's why I really like these patients, because I know that they're going to be thrilled in a couple months. So there are many medicines that we're using now for psoriasis. I'm going to use something called an IL-17 blocker. The reason I'm using it for this patient is not only does he have involvement of his skin, he has joint involvement. So you can see some changes in his joints, and he has severe arthritis. And what this tells us is that psoriasis is an inflammatory disease. It can affect the skin, obviously, but it also affects the joints. And that's what a lot of people don't realize. So one rationale for treating the psoriasis, not only do we clear the skin, which is an obvious benefit, but we can slow down or stop the progression of this arthritis. And in patients who don't yet have the arthritis, we have the potential to prevent it. So sometimes patients think when we're treating their skin, it's just cosmetic, but it's not. We're reducing systemic inflammation, which is reducing the chance for developing arthritis. And that reduction in inflammation is just good for their overall patient's health. So I'm going to see you in a few months, and we're going to see how much better this patient is going to do. Hi, Dr. Sullivan. I promised I'd be back with this patient. And if you look here, I hope you can appreciate how dramatically better he is. He still has a bunch of whiteness, but this is going to go away with time. The red, the scale, the psoriasis is gone. And that's what's really important is there's more than one medicine like this now. So there are multiple medicines that will clear people beautifully. So there's no reason to live with psoriasis. Even if you have relatively minor psoriasis, we have great medicines. The other thing that I think is really critical to understand is if you can imagine all this redness and inflammation here that you see in the first video, that same inflammation is occurring inside the body. And so later, if you have severe psoriasis, you're more at risk for arthritis, psoriatic arthritis, and you're more at risk for other common things like heart disease, cancer, because that inflammation is bad for the body in general. So sometimes people are concerned that if they're treated, that they're taking this dangerous medicine. But really what's happening is you're taking an extremely safe medicine that is changing your skin, but it's also changing the inflammation on the inside. Come visit us if you have psoriasis.